Welcome to our Mental Health Monday series for June, where we talk about various mental health resources that exist at UAB to support students with various mental health needs. Today, we will be hearing from Allison Solomon, the Director of Disability Support Services, or DSS, about what is DSS, how to use it, how to know if you're eligible for it, and things like that. So thank you so much for being here, Allison.
All right, thank you, Juhi and Dr. Lindsay. Thank you so much to both of you. I appreciate you all asking me to participate in this. Any chance that Disability Support Services gets as our staff to be able to educate, to provide any kind of outreach, we are happy to do that. One of the things especially that's important to us is the discussion around mental health, because I think a lot of times when anyone hears that there may be a student with a disability and thinking about what the needs of that student may be, a lot of times people typically go to something maybe physical. And the truth of the matter is we absolutely have students with many different kinds of disabilities at UAB, but a large percentage of the students that we serve through Disability Support Services actually have diagnoses that fall under different types of mental health disorders. So we work with a lot of those students to provide accommodations. And so one of the things I thought I would start with today is just telling you a little bit about DSS, a little bit about myself, so y'all can learn more about the office. So as Juhi said, I'm Allison Solomon. I've been the Director of Disability Support Services for almost 10 years now. I've been the ADA Compliance Officer for the past 5 years at UAB, and my entire career for 18 years now has been in working with students that have disabilities in higher ed. And so it's something that I love doing. It's constantly changing, and every day is different, and we work with all different kinds of students and faculty and staff, and so it's a great place to be, because the purpose of our office is absolutely to ensure that our office is meeting the needs of students with disabilities. So we fall under guidance of Section 504 of the Rehabilitation Act and the ADA law. So those are federal disability laws that make it very clear to institutions like UAB what our requirements are to ensure that we are providing access to students with disabilities. So the two primary things that our office is responsible for is, one, ensuring access for students with disabilities to our campus. And what that means is not just physical access, but access to programs, activities, events, coursework, whatever that may be, ensuring it's accessible to students with disabilities. So that's one of the purposes for our office to exist. The other purpose is to prevent discrimination. And so we want to make sure that we're educating our faculty and staff and everyone in our community so that they understand what their responsibilities are, and understanding what the ADA and 504 is, so that while it could be on purpose, it could be unintentional, they understand what is appropriate and what is not, so that we prevent discrimination against students with disabilities on our campus. So that is really the core of why we exist and what goes into the purpose of the Disability Support Office and the compliance work that comes out of our office. But our goal day to day is making sure that we're ensuring student success. And we're in a unique situation because we serve not only the students, so of course, we have a process that students go through to get registered and provide accommodations, but we also provide a service to faculty and staff. Because a student will go through, and in a minute I'll talk about the DSS process, a student will go through and get registered with the process, but then they go and they apply those accommodations in the classroom with a faculty member. And so some things may be really easy to work out and really easy to understand, but some things might not. So we view our responsibility is to serve the student, but to also make sure we're serving the faculty and staff, making sure they understand what they are supposed to do to work with students, but also if they have a concern, like maybe this might not be appropriate, that they can have a conversation with DSS so we can make sure that we're ensuring the integrity of all of our programs at UAB, but also making sure that students get reasonable accommodations as well. So that is in a nutshell, kind of some of the things that go in that make up DSS. I'm going to attempt to share my screen now, and really hoping that in doing so, I do this the right way. If you can bear with me for just a moment, I'm going to try to do that. Just a moment. not going to allow me to do that just yet. That's okay. I'll tell you what, rather than sharing the screen, what I'm going to do is kind of continue to talk through, if that's okay, Dr. Lancy and Juhi, if that's okay. What I was actually going to pull up was the UAB DSS website to be able to really walk through. What I find in presentations like this, the best thing to do is to really show people how you do it. And so what I'm going to do instead is kind of talk through that instead. But first I want to give a little bit more information for...
Oh, excuse me. I just made you host, so maybe that would help instead of being co-host.
Okay.
And if you share screen and go to like desktop, share screen, the first one where it shows the images on the top left, it might allow you to do it that way.
Okay, let's see if it will let me do that. Okay, and I'll go back to here. There we go. Is that working for you all? Can you see the Disability Support Services page?
Yes.
Yes, it's working.
Awesome, wonderful. Okay, all right. So in order for students to go through the process, this is our website. This is the place that students will need to go to be able to start the process. But before we do that, I thought it might be interesting to share a little bit of data with you all, just to get an idea of some of the students that we are currently serving at UAB. So right now we have right at 1,200 students that are currently registered with Disability Support Services, and they have 95 different diagnoses. So that, if you think about that for a second, that is a lot of students that we're serving, but that's a lot of different disabilities as well. And so we always give the example is, you know, there's not one set of accommodations for one type of disability. It's very individualized, and it depends on the student and how it impacts them and what the disability is. So you can imagine with 1,200 students and 95 diagnoses, it's very individualized. And many students we find too have multiple diagnoses, so they may have 2 or 3 different disabilities. One of the things in terms when we're talking about mental health and how disabilities are served in our office, we currently have 235 students that are registered under the umbrella of a psychiatric diagnosis. And under that, we have 34 different types of diagnoses that fall under psychiatric disorders. So that can range from anything like anxiety disorder, that could be depression, bipolar disorder. You know, again, there's 34 types that we are currently serving in our office. And it's important, I think, for students to know that this applies to all students at UAB. We have students currently registered with our office and have for years that range from freshmen who are coming in the door to, you know, all undergrad students, you know, of course, sophomores, juniors. We have students in professional programs. So med school, PT, OT, optometry, you name it, School of Health Profession, public health. There's not a school on our campus that does not have students that are currently registered in that. And one of the things that we noticed a few years ago is a real rise in students in School of Medicine, interestingly enough, that had diagnoses and finally felt that the culture of the med school was one where they were aware that students had disabilities, understood they were capable and able of having that disability, applying accommodations and still being successful and meeting the requirements of the program. So I think that's really good when we see that there are students that have disabilities and that there are measures in place where students can get assistance with that. So I think that's really important. And I will mention too, I'm going to go through real quickly here just to show on our website a little information here about our staff so that you know who you would be working with in disability support services. So there is, some of these pictures are a little outdated, but as far as the folks, but so there's myself, I'm Allison Solomon, as mentioned. Valerie Dubose is our associate director. Andrew Sparks is our assistant director. Courtney Champion is our ADA investigator and faculty advisor. That position is only a little over 2 years old, but we created that because what we found with faculty and staff when we were working is that maybe there would be an issue going on and you'd have a case manager like maybe Andrew, who's working with the faculty member and working with the student. And you know, what we were hearing from individuals were, you know, I kind of feel like you're talking to them, but I want someone to talk to just me. And so we were like, let's put this in place. So the faculty member has their person that they're navigating the conversation with, and the student has that counselor that's focusing on them and walking through it. And at the same time, our office can work together as a staff to support everyone involved. So next we have Allie Reeves. Allie Reeves is our Accommodation Services Coordinator. Previously her position was the testing coordinator, but she is still doing testing, but she also has some additional responsibilities and a partial caseload at that point. Jenna's picture has not been updated yet, but Jenna is our program coordinator. So if you come in the office, you call the office, Jenna is the primary person that initial contact is with. Jalen Witherspoon has been a huge addition to our office. She is our accessible technology coordinator, and she has been outstanding because, as you can imagine, with our transition from you know, in class most of the time to this everything's virtual, a lot of content has had to be captioned because we're using video for so many different things. So she is doing a lot of work with faculty, staff, and in the administration at the university to make sure that we are producing and providing things that are accessible to everyone. And then Molly Clay is our graduate associate who is a grad student at UAB that's been with us. And Molly is very vocal. You've probably seen some articles where she has discussed the fact that she's actually a student that's registered with DSS and has disabilities herself, and is very out and comfortable talking about how that's been important to her. So that's just a little bit about, you know, who you're working with in the office. And each of our counselors have different caseloads as well, which is helpful. So that they can focus on those different types of disabilities that fall under different things. So if I have a student that is, you know, thinking about coming to DSS and not quite sure, we understand there is definitely an issue around stigma. That is something that we are fully aware of, that students may hesitate. And that's where we put a lot of training and faculty and staff education into educating people so that we can help students feel more comfortable about coming forward and getting assistance. And so a lot of work has gone into that, and we continue to do that just to be able to get the message out so that students are getting the assistance that they need. So one of the things that Courtney does is a lot of, she's, as a faculty advisor, does a lot of faculty trainings as well. And just it's for you all to know, faculty and staff have a lot of options too. We can come in and do training specifically with departments. One of the things we're offering right now that was offered in the spring as well, we collaborated with the Center for Teaching and Learning to offer the accessibility certificate. So there is a certificate program that faculty can go through, and if they complete all of the sessions and do all the trainings, they actually have that accessibility certificate that is something that they can complete, which consists of, I believe, 8 different training sessions that you go through with different DSS professionals to be able to meet that standard. And it's being offered again this summer. So those are currently being offered. So individuals can sign up for that and go to just one session if they want to learn more about something specific we do. But we also have to where just you can complete the whole series as well. A lot of times I'll say, you know, to students, you know, and this includes students with all kinds of disabilities, but definitely students that are impacted in terms of mental health diagnoses. A lot of times what I'll hear is that a student may have a disability. They may have, let's say, a psychiatric disorder like depression or anxiety. And it's amazing how often we hear that they don't see that as a disability. It's my anxiety, it's my depression, I do this, I've had this. And what we want students to understand and know is that that is a disability. If you have, you know, yes, everybody has certain levels of anxiety going into a situation. We understand that. But then there's a difference when we're talking about things that rise to the level of diagnoses. And that's what we're here for and want students to receive accommodations for. I had a student not too long ago that asked the question, we were talking about, you know, what could be done? What accommodations do I get for this disability? And one of the things I'd explain is I sat down and counted it. And as of right now, you know, I told you we have, you know, these over 1,200 students with 95 different diagnoses. Right now, we have 162 different types of accommodations. So there's not a, here's extended time, here's reduced distraction. It is the movement in terms of disability service provision over the past several years through often working with the Office of Civil Rights. It's changed a lot. And you are required to interact with a student on a case-by-case basis to determine what that student needs in that course. And there may be times where it's appropriate and it can be utilized in that class. There also may be times that it may conflict with a standard of that class, and we may have to look at other options. But that is something that is, really fascinating to me, doing this for 18 years. I remember when we first started out, you may have 15, 20 different accommodations. Which one is it? And now today we're at 162 accommodations. So there's a lot. But what I want to show you is basically on our website here, how to apply for services. This is what I would say to any student. If a student has a disability, especially if a student's been diagnosed, they know they have a disability, or if a student suspects they have a disability, it is so important to know about the resources outside DSS that we are so fortunate to have at UAB, namely student counseling services and student health services. There may be a disability that you have, and maybe you are trying to cope with that, and it may be that some accommodations are necessary. The great news is that we accept documentation from both of those offices, and they are able to provide documentation, for many of the things that are impacting our students. So my advice to a student, especially if they don't have a provider that they're already seeing that can provide documentation, is to consider going to counseling services or student health services and talking about what's going on. Because what we do require as part of our process is students go to the website here that you can see the Getting Started page. There is a button there to apply, and students can go on that site and actually complete an application. And that's the first thing to do to get the ball rolling, is you go on there and you complete an application, and it's basically some general information, but it does go into what your disability is, how is it impacting you, some general information so we can get an idea of what's affecting the student. The next step in the process would be providing documentation. So let's say that you have let's give an example of a disability like depression. If a student has depression and they see a therapist for their depression, on our website, one of the tabs here says documentation guidelines. On the documentation guidelines, what it actually provides is what it is that is needed by disability support services to be able to provide accommodations to that student. Now you'll see what it's called. It's called guidelines. So what that means is this is in general what we're seeking from the provider, so that we can have what's necessary to be able to say, not only do we want to help this student, but we have what we need to be able to be compliant with the ADA, which means confirming this is a student that's not simply struggling, but the student has a disability under the definition of ADA and the 504, those disability legislation laws. So we have to make sure that is there. But what I tell students all the time is looking at this can be a little overwhelming. Do I want to do this? It seems like a lot. I can't get in touch with my provider. At any point in time, any student is welcome to email or call, and we are happy to talk to them. Right now, we do informational meetings over Zoom now. I just want to talk through it. Here's how it's affecting me, and before I decide to kind of go through this and start this process. That is available at any point in time in the process to meet with a counselor. But what will happen if a student completes the application, provides documentation to us, they'll be asked to come in for an accommodation an accommodation planning meeting. It's similar to like an intake meeting that happens in counseling, but what that does is it allows us to sit down and have the information from the application and have the information from the documentation if that's come in yet, and basically talk to a student and get their self-report, because our position is that a student knows better than anybody how something is impacting them. And so that's important information that we want to have as we look toward determining what accommodations may be necessary. So that's one of the things that happens next. After that, our counselors will get together, our caseworkers get together, and they review the student accommodations and what their decisions are as far as, hey, this student, this is their application, here's their documentation. We have sufficient information to be able to go ahead and approve them so they can become registered with DSS, and here are their accommodations that they are eligible for. And so at that point, the student has an option, and they always have, even before we've gone in quarantine. The student has the option to do another meeting over Zoom where they can have that accommodation orientation meeting, or they can do it as there's an online component where they can do the whole process online. And at that point in time, the student is then registered, and part of what's explained to them is how to use their accommodations every semester, because there is a database that we have called AIM. And what students' responsibilities are each semester is to go into that database. Their courses will be pulled up in there. The student selects what classes they would like to use accommodations in, and then they select what accommodations in each class that they've chosen that they want to request in that class, and then it goes to the professor. And then it's the responsibility of the student to reach out and follow up with the instructor. And instructors are encouraged to follow up with students too once that letter has been received, but to have a conversation to make sure that, hey, I see your accommodations. It looks like everything's gonna apply here. I'm gonna make sure, I'm gonna ask that you do this way, you know, just what the details are. And also too, if, hey, I see you're asking for this accommodation, I'm not sure how it might apply here. Let's talk with DSS to kind of work that out if that's the case. So that's kind of the process as far as getting it set up, and having students requesting, and then they send those accommodation letters every semester in order to request their accommodations. And that's, you know, and we can talk more about accommodations if that's something that you all would like to talk about. I will say some of the most common accommodations that we see, especially in terms of students who may have a diagnosis that falls under a mental health disorder. Some accommodations that we often see are things like extended time, reduced distraction testing environment. We also see that depending on how the disability impacts a student, as well as how medication impacts students. This is something that's interesting too. We've had students that maybe the disability itself will create certain issues, okay? Certain problems that may make interacting and learning a little bit difficult. What we have seen as well are students that are having to take certain medication to treat their disability that creates a whole nother set of issues that may really impact learning more so than the disability itself. And so that is something that we can help with, and that is something that would be discussed so that we can make sure that we're not only treating the direct symptoms of the disability, but as well as any kind of impact of symptoms based on medication. And what I can say about working at UAB is that our faculty and staff are overwhelmingly supportive. And then what I find the reaction is not why, not what do I have to do? It's, okay, how can I best do this? You know, it's an interaction with the student or calling DSS saying, this is an accommodation I don't understand. And I'll tell you that certainly is not the way it is at every institution. So I'm very appreciative that we work here. But one of the most important things too, I think, you know, I talked about stigma a little bit, and I want to go back to that for a minute. It's so important for students to understand that your disability is confidential. The nature of your disability is confidential. DSS cannot share what a student's disability is, the nature of it. The conversation, if there is one between DSS and the faculty member, is about accommodations and how to implement the accommodations. And that's what the conversation should be between the student and the faculty member. And that's what we train faculty and staff to understand as well, is that you don't need to know what the disability is, even if it's coming from a good place because they think they can help. What you need to know is, what is the student requesting in your course in order to have equal access and that level playing field in your course. And so, you know, I share this, you know, a lot of times when I do trainings, and I'll share it here as well. But it's interesting because, you know, like I said, yesterday, the day before yesterday was my 18th year at UAB. So I've been doing this for a long time. And ironically enough, I've been on both sides of it, because when I was in undergrad and graduate school, I received accommodations. And it was one of those things where I was registered with the disability office, and you know, I'd used my accommodations. I can count on my two hands the number of times I used it. It wasn't very often, but I can tell you this: if I had not had it in place, it would have been very, very difficult and very traumatic in terms of trying to proceed and do what I needed to for my schoolwork, and if not having that in place. So that's why we also tell students a lot of times, if there's something going on, if you have a disability and you're able to, you have coping mechanisms in place and things are going well, it doesn't hurt to go ahead and get registered. And you know what? If you don't use the accommodation, that is okay. but it's nice to have that in place because this registration process, sometimes it can take a couple of weeks because you're providing information, we're scheduling an appointment. Right now we see that it's going very fast because things are so streamlined. We put a lot of effort into making sure to avoid those delays. But that's something that I'll stress that I think is really important. The other thing that's interesting too is that now, I've been the student, I've worked with students, and now I am the parent because now I have a student, I have a child of my own that just this year has an IEP plan, has a diagnosis, and I've been working with a provider, and it's been a positive experience. I'm grateful that I work in this field and have the information that I know to be able to kind of walk through it. But it does, I think, help in terms of working with students and having an understanding from many different aspects. But, the thing that's most important to me when I think about students, and I think about students who are who are impacted by mental health, especially if there's a disability, but also when I think about students who are advocates for ensuring that we are aware and meeting the needs of our students who may be struggling in terms of mental health, it's so important that the conversation continues to be had. And I just can't say enough about you all. And you're out there, you all are seen and heard and know that you exist, and when I mentioned in my staff meeting that I was going to be doing this, everybody knew who it was. And a lot of times when you throw out letters, people are like, what's that? And I was like, they knew exactly who it was when I was talking about mental health ambassadors, which was nice. So, I think that, what you all can do is exactly what you're doing now, taking the time to give an opportunity for us to be a part of the conversation. I think that's one of the things that's been difficult in the past is there's been a lot of discussion and work around mental health, and people haven't always thought about disability support services as part of that. But that's where in the classroom, we can really step in and help and maybe do some things that are really helpful. I do want to share too something that's coming up soon that would love y'all's assistance and promoting it if possible. Disability Support Services has been working through the quarantine time and really looking at, in the spring and March as we do a lot of training and education, and of course that's been difficult given the circumstances of what we're dealing with. So what we ended up doing was developing what we call the DSS web series. It's webisodes, or what we're calling it. Most of them are about 5 minutes. They're no longer than 10 minutes each, but these are interviews where it's a DSS staff member interviewing different faculty, different administrators, and having conversations about access and about inclusion and talking about specific things as far as assistive technology. There's different topics that are being covered, and one is going to be released each week beginning this week. So the first interview is, the title of it is Promoting Access and Inclusion, and it's an interview that I did with our provost, Dr. Pam Benoit. She and I interviewed I interviewed her a couple weeks ago, and so we've made sure to get it captioned and have a transcript available, and so that's going to be released out through marketing, I believe, on Thursday of this week. And so we've done several different ones. We were scheduled to interview with Dr. Dilworth, Office of Counsel, e-learning with Smira, many different individuals. And so what we're going to do is release these over the summer, but we also have a list running of others that we'd like to interview. And so, I think it might be great. This is such a wonderful organization, and if y'all would be interested, I'd love to add y'all to the list of people that would be willing to do an interview with DSS. Okay. Are there any specific questions? I talk a lot, so I would feel bad if I realized there was a question that went up that I didn't answer, but please let me know if y'all have any questions.
I had a question.
Sure.
I'm not a student. I was just asking. And about the disability. So let's say there's a student who's had a disability, but they haven't had it in a few years, and then it just automatically just reappears. What would they do? Could they do the same thing? They'll just have to get that same information from maybe a few years ago, those records, and they can still get those services?
Absolutely. That's a great question. Yeah, I mean, there certainly are diagnoses that where they're impacting the student, and then they kind of go dormant for a little bit and they're not impacting the student. And so what I would recommend in that case is a student to follow the process and just go to the application, fill out the information that they have. And what I would do, especially if they have a previous provider that maybe treated them for that in the past, I would go ahead and get that information and get that to DSS. And we're happy to start with that. If we needed something more current, we could then let them know. But a lot of times I'll tell students, before you make plans to go and pay to have an assessment for maybe a learning disability, things that require a lot more in terms of assessment sometimes, is let's start with what you got. You know, there may be enough of what you have, and we certainly, you know, our goal is to not create barriers. It is to remove barriers and do what we can to get you in to assist you, but also making sure we have what we need to be compliant with the law. So yeah, absolutely, in that case, I would start the process, and that would just be part of the conversation, is, you know, this was part of what was impacting me, and now it's back. What do we do now?
Hi, Allison. Thank you so much for all of this information. It was great. I had a question, like mostly out of curiosity. Are there any DSS offices like nationally that also include someone that can assess students and like provide that documentation that then gets like sent within the same office?
Yes, Juhi, yes, to answer your question, there are offices that are like that. A lot of times it's not actually attached with the office because it can be seen as a conflict of interest if you're actually assessing and making disability determination. But what we see more common is some institutions that have testing centers built in, and there are psychiatrists and psychologists, and you go there and you get that service provided. So that is something that I think would be wonderful to be able to have that, you know. And I know that one of the things I see happening in our student health services is a continued growth. You know, they recently added a psychologist to their team, and so I think that's very helpful. And I know there are definitely priorities and things that they have in place for work for that individual, but that gives me a lot of hope in terms of looking at, okay, what do we have now? Where are we going to go? So I think that's very interesting. The other thing our office does is, in the event that there's a student that has a disability that does not have documentation, and it's not something that they're going to be able to acquire from a general practitioner like over in student health, or a licensed counselor in counseling services, we will work with them to identify maybe some outside entities that can provide assistance to them, like the Department of Rehab Services, which would not be any cost. We really try to work to connect them to get them what they need. And we also work with students too, whenever possible, to be able to see, okay, what do we have? Do we have enough where we can do some provisional accommodations? Let's put some things in place and give that person time to get that assessment done. So, you know, sometimes there's enough information that a student has that we can do that. So again, trying to do what we can.
Yeah, thank you so much.
Sure. Any other questions? Okay.
I thought it was a really helpful presentation. I've been kind of wondering about just like the mental health aspect of DSS, and I'm too anxious to ask anyone. So I was actually very grateful for this.
Good, yeah. And yeah, it's very common where you know, like I mentioned, that informational meeting where somebody could come and just talk, and they could decide they don't want to do this, and that's okay. You have some offices at other institutions that are like, you haven't filled out the application, we can't talk to you. Like, no. And sometimes you might not want to come in, and right now coming in is not an option since we're not back at school yet, but I'm always happy to. And I've talked to students throughout the quarantine too that are trying to figure this out, and what, you know, we've done phone calls and just kind of talked through, and that way the student can make a decision for themselves. Okay, getting off the phone and I'm filling out this application, or, you know what, I want a little bit more time to think about it, whatever, and we support whatever they may do.
Well, this was perfect. Thank you so much, Allison. You've answered a lot of questions just broadly about your office, but also particularly relevant to mental health concerns and getting the supports for that. So really, really appreciate the work that you and your, department and office does for students. It's fabulous.
Right. All right. Well, thank you so much. And if there's anything we can do anytime, whether it's partnering to do something or just talking through anything, that we stand ready to partner with you all and appreciate all the work that you're doing. It's fantastic. So congratulations.
Oh, thank you. Thank you so much.
Okay.
I think because I made you host, I can't stop the recording.
Okay.
So.
Okay. All right. Let's see. I'm going to go in and stop now. Okay. Y'all take care. Okay. Thank you.
All right.